Hey, it's Jordan with Status Coup. We are in East Palestine, Ohio, following up on the ongoing, keyword ongoing, disaster here. It is now 14 months since Norfolk Southern unnecessarily chemically nuked East Palestine, and I'm here with the victims, frankly. I gotta say, this is our Status Coup's sixth trip, but it's my first. Lewis did great work here the other times. John has been here several times. But why it's so important, I think, to be on the ground, unfortunately, within 2 minutes of walking into your house, I immediately felt some kind of head rush, almost like a delirious, dizzy spell. I've had it in other places. The last one that comes to mind is Kalamazoo, Michigan. I was a block away from a paper mill that was emitting horrible, like way too much hydrogen sulfate and toxic gas, and I felt delirious, and the same feeling came to my head, and that's just 2 minutes being here. So I can only imagine what you guys are going through living here, not to mention everyone else. But to remind folks, I'm here with Stella, her husband Daren, and you've lived here your whole life?
60 years, my whole life, yes.
And this is your family's home.
Right.
And it's clearly contaminated, and Norfolk Southern is not willing to permanently relocate you or anyone else in this community. Tell folks who are coming to this brand new, you left here, you were temporarily relocated, but as soon as you came back, you started having symptoms again.
Right. We were gone for 10 months. We were relocated for 10 months. And over those 10 months, I would come back maybe for an hour or so thinking that, I was going to clean the house or I was going to do something, and I would get sick and have to leave. And then they ended the relocation program, and we moved back, and I've been sick ever since. We left one time. We went out of the country for a week. And when we left, I was so sick that Daren had to pack my bags. And the only reason we went is because we couldn't get our money back, this trip that we had planned. So we went, and I was there less than 24 hours. All of a sudden, it was like a miracle. I felt perfectly fine. I spent a whole week there, had a great time. I was no headaches. I didn't have to use my inhaler one time while I was gone. We came back, and in about an hour after I walked through the door, I started getting that feeling like almost like you're high or you're drunk. I had to get my inhaler out, running in the bathroom. And I mean, there's days when it's worse, like rainy days like today.
Right before we got here, it was raining.
Yeah, I feel like disoriented, and it makes you feel really lethargic and sort of shaky. Some days it's not that bad, but like when they were digging up the water lines or they're digging up dirt, it gets really bad when the street sweeper, we had the street sweeper out here a few days ago, went down the street, and like 20 minutes later, my granddaughter come up, she says, "Grandma," she goes, "I've got a terrible headache." I had a headache. My other daughter, who's a veteran and has a disabled veteran, she came down and she said, "I don't know what's wrong with me." She said, "But my legs are hurting so bad." And it's when they stir things up.
Yeah.
Well, there's no doubt. I mean, it's people getting sick, and the EPA flat out refusing to do any indoor air testing. I mean, they said from the beginning, anything that needs done, Norfolk Southern will pay for. So what's the big deal about testing the air in our homes and give the bill to Norfolk Southern? I've been calling the EPA the environmental polluter's assistant in this case. It's clear you just can't have a disaster like this and everything's okay. I mean, all the studies, the science that he's talking about, that's for one chemical. there was like 30 chemicals on the train, and
then the
when you mix all
combination.
them together, nobody knows what kind of stuff that there's probably not even names that they haven't even discovered the stuff that's here in town. It's just, somebody. I don't understand.
Well,
we have so many smoking guns about how bad things are, but nothing ever comes of it. It's like you said, it's swept under the rug. It's
Can I ask you, for people who didn't see, you were at a conference and were able to speak with former Vice President Al Gore.
That's correct.
What did he say to you?
Well, it was Climate Week in New York City, and I had the opportunity to meet him. And he knew all about it. He on his phone he had the shot from space that showed the plume, and he looked at me and he said, "Daren," he said, "I'll tell you." He said, "What they're doing to you people in East Palestine is criminal." I mean, that was his exact words that he told us. But and you
Nobody's
ask
doing
probably
anything
anybody,
about it.
Anybody knows anything about it knows it's criminal. I mean, it's, from the NTSB saying they didn't have to blow it up, the EPA tested homes that they admitted didn't pick up the levels.
CDC got sick and left. Wouldn't you thought that had been enough evidence when the CDC workers got sick and left town?
How much more do you have to prove? I mean, if I would have caused this chemical spill, I'd have been shipped off to the farthest prison somewhere, and that'd be the end of it. It's.
Well, I'd also like to ask you, because this seems to be the go-to response across America. What do you think about, the bottom line is, why is the federal government relying on Norfolk Southern, the multi-billion-dollar company who has every incentive to minimize what's going on here? Why are they relying on Norfolk Southern for testing, reimbursements, all this stuff? Why isn't the federal government come in?
Because Norfolk Southern owns the federal government. That's why.
I mean, it's
BlackRock, Vanguard, Norfolk Southern, they're all in the same financial group togetthat. Yeah. All the politicians are stockholders in those companies. BlackRock that owns the whole country, Norfolk Southern, I always say, is one of their kids. And then the politicians, they all have stock in these companies too. It's all about money.
Not only that, but the lobbyists. I mean, they've been paid off for so many years. Now it's time. What have we been paying you for? It's time to turn the tails on this. So it's.
And the thing about it is, I ran into one of my neighbors at Rite Aid Saturday. She walked up to me and she whispered, and she said, "I just wanted to let you know," she said, "that we have your back." She said, "Even though people say that you're just making this up about being sick," she goes, "I want to let you know," she goes, "I'm sick too." She said, "I've been to the hospital 4 times," she said, "with lung infection and bronchitis." She said, "I get really bad headaches." She said, "My daughter's had headaches and leg cramps." She said, "But I'm scared to death to say anything." Jamie, my daughter, the one that's the president of Unity Council, she gets overwhelmed with private messages of people, school teachers, people that work for the city that are afraid to say anything about being sick. So the people that you've talked to that are sick are just the tip of the iceberg. There's another neighbor here who has little kids. Her kids have been, her husband works for the government. Her kids have had headaches, nosebleeds. She gets headaches. She's afraid to say anything. A lot of people don't want to be ridiculed. A lot of people are afraid. Some of the teachers are afraid for their jobs. Some of the people that work for the city are afraid for their jobs. So the people that aren't afraid to speak out are amongst the few of the people who are really sick. And I have a feeling that if all these people came forward, people would be absolutely shocked and flabbergasted.
I hate to say this, but we have to speak reality. It's probably cheaper for them to settle now before hundreds, if not more, people start developing cancers.
Right.
This year in August, I was diagnosed with breast cancer. Mm-hmm. I've gone through 2 surgeries in 5 weeks. Mm-hmm.
I don't know if Norfolk Southern had anything to do with it, but I got breast cancer. I've lived in that house for 25 years. Now, the research that I did, vinyl chloride, extended exposure to that will expedite the cancer.
You know, it is striking. About half hour before we got here, President Biden was speaking about signing a bill for $95 billion of aid to Ukraine, Israel, humanitarian aid for Palestinians, Taiwan. Whatever people think about, you know, those separate issues, it sure seems strange to me that the federal government seems to have endless money for other countries, but they are not giving you universal health care. The federal government is not forcing Norfolk Southern to permanently relocate and pay for it.
Federal government hasn't given us so much as a bottle of water.
And that's the other thing. I mean, when the Ukraine package was up a couple months ago, the provision for East Palestine was also included in that. So the reimbursement money we got from Norfolk Southern was included in that, so it wouldn't be taxed. Well, there's no mention of it this time when they passed it. So, you know, we're still stuck with the tax from being relocated for something that wasn't our fault. And not only that, you know, I worked construction my whole life, and a 1099 by law is supposed to be out by the last day of January. It has, you know, you have to have it in your possession,
Federal law.
postmarked by January 29th. Well, Norfolk Southern sent all their 1099s out late March, early April. So, I mean, I just, again, baffled how they
1099
you know,
is for income. How is it income?
They ran a train that they knew was on fire. They intentionally blew it up when they knew they didn't have to. They was in total charge of the cleanup and all the testing, and now they decide, well, we're going to pay $600 million and that's the end of it. I mean, if you was to write a movie like that, it would be so unbelievable nobody'd watch it.
And how did they?
And here we are living it. You know,
They're going to
14
pay
months.
that $600 million to a 20-mile radius. All right. Where did the 20-mile radius come from?
I'd love to know.
Yeah.
I don't get that either. They relocated people in a 1-mile radius as long as you weren't in Pennsylvania.
Yeah, and that started out from just if there was an explosion, that's where shrapnel could possibly travel. is
And then
1
they
mile.
used that.
That was the original 1 mile evacuation
Well,
zone.
But where's the 20-mile now?
I
Why
gotta-
ain't it 50 miles?
It's got to be extremely, you know, emotionally and mentally tough to worry what's going to happen to
I
your
don't
grandkids.
sleep at night because I see, you know, my granddaughter, one of the twins, she's 14, she's, Grandma, look at my head. There she is with scabs and open sores and rashes and, you know, Grandma, do you know anything I can do for leg cramps? My legs are hurting me so bad. You know, Jenna, she's 18, she's going to be 19, she has a boyfriend, and, you know, are they going to be able to have kids? You know, she has female issues all the time. She's been having these seizures. What are these seizures going to do to her? And to know that it's like me watching somebody douse them with gasoline and they're walking towards a fire and I'm standing as far from me to him and there's not a damn thing I can do about it because I don't have enough money
get them away from the
to
situation.
get them out of the situation that they're in. You know, it's not because I don't want to. It's not because it doesn't torture me. And it's not just those kids. You know, I see these little kids running around town playing in those creeks and throwing rocks in the creeks. You know, my one little foster boy that's 12 years old, he goes, can I get down and play in the creek with Logan? And I said, no. You know, and I have explained to him, if anybody's kid should know about the chemicals in the creek, it should be mine. You know?
I mean, it took them, I think, 6 months to even put a sign up. You know, in these heavily contaminated
you know, I'm
waterways.
old. I'm gonna die, and here I gotta sit, and this is what I get to do for the last few years of my life. Is I gotta sit and watch somebody poison my grandkids, and I know where it's coming from, and I know who's doing it, and there's not a damn thing I can do about it. I do everything that I can possibly do about it, and there is nothing that I can do about it. And, you know, we're gonna figure out a way, and like I said, if it takes us selling every single thing that we have and moving first and taking some of them with us, we'll get the rest of them there too.